It's really my privilege to have been invited by Fred. I have visited Uganda as his guest on a number of occasions, and so I feel very much connected to the folks in this audience, whether I've met you in Africa, whether I've worked with you at Columbia, Neil, whether I've worked with you at University of Illinois, Debbie. I have a lot of connections, as well as my team, Amu Kowalik and Dan Ferris from New York University. So thank you for having me. And then, did you notice that Fred took some extra minutes and now he's going to want me to get on time? So I'm going to do my very best to kind of set the foundation for this meeting, to give us some things to think about why I think this conference is so important. I am one of those social work types that Neil mentioned. I'm very proud of that. I went to the other school in Illinois to get my PhD at University of Illinois at Chicago. We always claimed Hull House, Neil, so we'll have to discuss that history. But why do I feel so connected to this topic? Because Neil did a fantastic job talking about the founders of my profession, that they tried to help individuals, they tried to help families, but they also tried to improve communities and raise the platform on which kids and families actually stand. And that's what I think Fred does. That's what I think Debbie's work does, Neil's and others, is really try to do multiple things at the same time. And so I'm going to get to Susanna in just a minute, because the NIH has also invested heavily in multi-level interventions, that it's not just enough to help individual children or strengthen families, their communities have to be better. We have to address structural barriers that actually push kids and families into poverty and all kinds of the other health negative outcomes that they experience. So I'm going to try to lay a foundation. I have some slides, but I promise, timekeeper, I'm not going to go through them all, okay? So I'm just going to talk about a future. I am going to talk about local work. When I mean local, I'll talk about New York City, but I'll try to set it in at least somewhat of a global context. Claude Mellons, my colleague, is going to talk 2 panels later around our work in South Africa, around HIV prevention and care approaches for young people. So I'm going to try to set this in a global context, but I'm also going to try to give you some things that I've learned from Fred and some ways that you might want to think about some of the work that we're doing locally in a global context. So I'm going to talk about an agenda, and I am going to say thank you to all kinds of funding opportunities that we have had along this journey. I am incredibly grateful. I don't represent this agenda without thinking about all kinds of people that work for me currently in the past. I can't believe I see Dr. Kang in the audience. We're going to talk a little bit about the pilot work when Claude gets there as well. So I now work for a place that has an agenda. So Debbie, I don't know if that makes me old as well. I think it probably does. But you start to leave just an individual study and start to think about what's your body of work about. And that's what our institute at New York University has allowed me to really think hard about, is what is my research agenda and how does it map on to a mission that is very focused on poverty. And so I have the real privilege of directing something called the McSilver Institute for Poverty Policy and Research at the NYU School of Social Work. And I'm going to talk to you a little bit about both our individual research studies within that institute, but also our larger agenda that my hope is will set the foundation for today. So there's a couple of things that I think are really important about this body of work that I want to just highlight, and I'll mention them briefly and maybe come back to some of them. So our institute is focused on addressing the root causes and consequences of poverty, both locally and globally. But we cannot mistake that poverty is not distributed equally. It's linked with race and racism. It's linked with particular continents. It's linked to historical factors that have shoved some kids and families and populations into poverty and plucked others out. Incredibly important to our institute. And because of those issues that really have had, in my case, that my body of work is kids and families, had kids and families on a very unequal playing field, We really think hard about our institute as being an applied poverty institute, which means that we have an absolute mandate to, if we learn something, figure out how that new knowledge creates a more even playing field for kids and families. And I think that action research agenda I'll talk about again and again as I go through this talk. So what defines some of our activities? The first, and Susanna has put up with me for decades now, our commitment to collaborative research, our commitment to draw on collaborative and action-oriented research paradigms to define our research. And these are just a couple of definitions that I see Fred in Uganda and so many others in this room truly also committed to participatory research. What's the kind of definition of those research methods? First of all, that you can draw a pretty direct line to the direct benefit to your participants. And that's really challenging. Fred is fielding a set of studies that's meant to answer research questions. He's got to randomly assign schools to a really fantastic intervention that he calls SUBI or he calls Bridges. But what's the comparison get? What's those comparison schools get? And so how he really thinks about research designs that has his participants directly benefit, very challenging because he also has to go through peer review. And he has to get through kind of randomized controlled trialists that say, well, what about a no treatment control? And so I think that these are pretty challenging methods to kind of think about how do I include direct benefit from my study? What are those direct benefits? How do I really use collaborative methods to have people, even as the study's going on, directly benefit? What distinguishes also some of our research, we have ongoing participation. When I was here in Chicago, we started our first community collaborative board. I must admit that we had no idea whatsoever what a community collaborative board did. But in fact, we've learned a lot about the unbelievable gift and benefits of involving youth, family members, service providers, policymakers, funders, and a host of other key stakeholders into our research. These are our very good-looking collaborative board members. This is a board that has met, I like to say that I've been at these collaborative boards for now, Debbie, we are old, like a couple of decades. But this is a board that meets every other week still, overseeing a very large body of NIH-funded research. So the bulk of what I'm going to talk about from here on out are a select examples of some of the studies that I think map on to what Fred's already talked about and what some of the speakers are going to talk about later. The study that actually began my career took place just a few blocks from here. We called it CHAMP. It was a collaborative HIV prevention and adolescent mental health project, funded in the early 1990s as HIV epidemic was moving into poverty-impacted neighborhoods in Chicago and all across the U.S. I like to say that Barack Obama and I organized in the same neighborhoods. It's my one close brush to fame. He did it in a different time than I did. But CHAMP started on the south side of Chicago, and that was the first NIH-funded study where we said we were going to use a randomized trial method, but we were going to make key decisions about that trial with community members. We were going to make key decisions around design, around choice of measures, around questions that community members could weigh in, all in the service of preventing youth exposure to HIV. And we had a number of iterations across this CHAMP-related work. And the one that Claude is going to talk about is set in South Africa, but we've also had a number of other CHAMP projects that really have been set across the globe. In South America, in Argentina, I mentioned South Africa. We also have an opportunity to work in Asia, in Thailand and Indonesia. But what kind of cuts across this entire body of HIV prevention and care research? The notion that there's a science base. And I really appreciate Neil mentioning that. There's a science base to what we do as we start to put together interventions, but that also there's a local context that must be infused in these studies if you're going to go global. So as you think about what you're about to embark on, SSA, in terms of global, we've learned much in this country. But as I traveled with Fred across Uganda, I was really clear that we've learned much and I know little. And that we really had to put together our science with also what was going to be acceptable to young people and their families. What could communities sustain? I'm so happy to see the financial institutions here. I've traveled to a number of banks with Fred as well. What could be sustained by the community when the research is over? That's been an important part of some of the work that we've been working on. What are some of the activities that define kind of our agenda? We work a lot with public safety net systems, knitting them together, making sure they're the best that they can be to serve poverty-impacted young people and their families. We do a lot of work around training and technical assistance as part of our agenda. That's usually not in a research program, right? It's usually an NIH portfolio of research that we present, we write about. But remember I said that McSilver is committed to rapid translation. So if you're committed to those findings making, a difference, how do you then get the word out in the way that can change the systems that are supporting kids and families? And so I'm very happy about, our technical assistance centers. We're also really trying to design new ways of service, and that's, Fred, what this is all about, is that psychosocial interventions are incredibly important for kids and families, but there's also need to be in components. And I think that you were really one of the early brave social work professionals, academics, that really tried to tackle poverty. In addition, pretty courageous for like an assistant professor, right? And so our developing center is really trying to put together new interventions. This is an NIH-funded developing center, really to put together new interventions, test them, and see if we could make some rapid scale-up with some interventions that have some science behind them. So let me just end with one particular study where we've tried to integrate both psychosocial supports, mental health supports for young people with economic strengthening. And I have to tell you that Liz Berber is in the audience, and she probably made these slides at some point in her life with us at Mount Sinai. So our research group is focused on young people and their families. And one of the challenges, if you care about kids in poverty and then try to walk this research walk, is that kids and families in poverty have a number of challenges, and many times you're applying to address one of their challenges, but there's overlapping set of outcomes that we want to impact by our interventions. And so many times the same children are exposed to violence as they are exposed to poverty, as they have mental health challenges, as they experiment with substance use, as they engage in risk behavior. And so those are the kids that we are really trying to think about. How can single and modularized and integrated interventions impact more than one outcome? The other piece that I think are really important is that you can misinterpret the next study that I'm going to talk about, that you have to remediate children. You have to remediate their families, when in fact how kids and families got here was really not very just. Many of the kids and families that are participating in your studies and our studies are kids where the world is kind of stacked up against them, as opposed to the world has facilitated their health and their well-being and their access to good education and safe communities. And so we think about social equity issues, we think about disparities, and then we also kind of we kind of have the kind of basic hypothesis that if we're going to do a really good job with our research, we also really have to collect data and involve those from the target community where the findings are ultimately, we hope, going to land. You see, Fred, all those slides I'm stepping just for you? So I'm going to talk about just one very brief study that is focused on helping young people get a high school diploma in New York City. And I'm going to focus on that high school diploma, and then I'm going to make it more complex. It's one thing to get a high school diploma when you live in a poverty-impacted community and your high school doesn't have as many resources it needs. But then you stack on top of that, I come up with a mental health challenge, a serious mental health challenge. I might even engage in risk behavior that puts my health and the health of others at risk. And so how do you help young people who are struggling with poverty, their families are struggling with poverty, they're going to high schools where the graduation rate, now there's some controversy in New York City. If you ask our last mayor, we've made great improvements. About 70% of kids apparently graduate from New York City high school, right? We have a new mayor. He says the number might be a little different, so you might want to pay attention to high school graduation rates. And then the number is yet different still when I go into our newest high school and I look at the first cohort of kids that were scheduled to graduate, and only about 40% of those kids are going to cross the platform to pick up their diploma. So this particular study, we're testing a program that we call StepUp. It is a program designed by young people who are having challenges in their high school for young people. So youth voice, family voice, very strong in here. And that we think that these kids need mental health supports. They're clearly displaying very big challenges. But we're going to focus on both mental health as well as helping you get out of high school in this particular study. Far from too many of the kids are in the same boat. They have mental health and substance abuse challenges that overlap with academic underachievement, high school dropout, early pregnancy, HIV risk behavior. What does this high school diploma have to do with poverty? Fred will tell you what diplomas have to do with poverty globally. And I just want to call your attention to some statistics that suggest that without a high school diploma, you're really pretty stuck, even in this country, in this city, in terms of poverty. So what are some of the statistics related to a high school diploma? If you don't pick one up, your average annual salary is going to hover around $20,000. If you manage to cross a stage and pick up something in a red case that says you have a high school diploma, on average your annual income will be $10,000 more. And if we could help you actually pick up a BA, it'll be on average $36,000 more. So in terms of one of the serious things that we could help populations do to get out of poverty is we could help those kids graduate from high school. There's other dismal statistics that I won't tell you about in terms of unemployment, but there's a couple of things that I just want you to come away with. High school dropouts experience poverty rates in the neighborhood of 30-31%. If you have a high school diploma, if you graduate from high school, your poverty rate is likely to be on average 13.5%. But this is like the big kicker. Among dropouts between the ages of 16 and 25, your incarceration rates, if you did not pick up a diploma, are 63 times higher. And so if you think about the costs, the human costs, the societal costs, the institutional costs, I'm not an economist, but I hear that they have some at SSA, says Debbie. That's a lot of high costs for kids not being able to get out of high school. And so that's what StepUp is about, are there ways that we can address kids' mental health difficulties simultaneously for helping them pass chemistry? And so that's been the challenge that StepUp is really kind of focused on. And this is a framework that I've seen Fred use and others in this room. How am I doing on time, timekeeper? Okay. I'm going to finish early, Fred. And so we take very much kind of a resilience or asset framework, because there are a set of factors that really do influence whether kids struggle and whether they succeed. What are those factors? There's individual characteristics, there's family characteristics, there's institutional and contextual factors that promote resilience. But I must say that even though we know this, and Dr. Guterman, you did a really important job underlying the kind of science base underneath social work. We know the science exists, but then how does it inform the programs and services that we provide? It's a little complicated. And so in StepUp, what we did is we kind of mapped these big conceptual categories, and then we had to put together a program that was meant to build those assets, that was meant to strengthen those assets. And that required a grid, and those of us that do clinical practice in this room, very few of us are practicing from a grid like this. But in fact, unless we were systematic and really strengthened, for example, young people's constructive use of time, their attachment to their families, their access to opportunities, unless we really map that, practice can be quite unscientific and unsystematic. And so in StepUp, There is a menu of options available to young people. When you go into an adolescent clinic, we often don't trust young people to take advantage of their menu. We tell them what they need, they tell them what treatment looks like or what their program looks like, but this is the menu of options that is available to young people in StepUp. Skills focus groups, one-on-one mentoring, family engagement, work in the school and the teacher to do well, academic supports, but oh yes, Fred, guess what? Academic incentives in the way of building assets. One of the things that Claude might tell you about is about a set of stories in the New York Times around a young person who actually her family drove her around trying to look for open access internet because she didn't have it at home. So the resources that one needs to actually be successful in high school and college, so there's academic grade incentives, opportunities for internships and career days, leadership groups, all part of StepUp and all part of a menu of options that kids can take advantage. They can take advantage of one component, they can take advantage of a whole set of others. So I'm not going to be able to go through all the data except to tell you that thanks to the Robin Hood Foundation, 361 young people have been in this trial so far. We have had at least enough initial success within our city that New York City DOE has picked up components of this program. We'll be able to test them now. And Fred, I'm not as ambitious. 48 schools scares me, but you'll be my role model, and I'll see if I can get there. And so for right now, I'm just going to leave you with a couple of things. The first two cohorts of kids are through their 4 years of high school, and so what happened to them? I'm going to get to here. One of the things that happens when we base programs in high schools is that kids like to tiptoe and walk away from those programs, particularly in high schools. So adolescents don't love staying after school unless it relates to basketball or some other thing. And they certainly don't necessarily love to stay after school to go to youth skills groups. But StepUp was, with that menu, was able to engage about 87% of those kids. And that's much better than some of the traditional programs that we offer kids. But then, as we started to track the kind of graduation rate, what we saw in the most conservative estimate, about 89% of those kids are graduating from high school. The statistics in comparison around kids with mental health challenge, about 45% of those kids graduate on time. And so I'm just going to go with, Susanna always cares about sexual risk behavior. She needs to. We had one pregnancy. I don't know what those StepUp folks did in terms of staff, but that's a really low pregnancy rate for kids with this level of challenge. So, what do I think our poverty agenda is? I think that research has a really important role to play in terms of how we enhance well-being and meet basic human needs at the same time for all people. But I think, Fred, you're a role model for us in terms of really paying attention to a set of young people that, he's very fancy educated. He went to Washington University, got a great big PhD, and could have forgotten those kids that lived in Uganda and did not. So your commitment to enhancing and not leaving those kids behind, incredibly important. The other thing is that you can't work, if anyone has ever worked with Fred in Uganda, where are my Ugandans here? Are you here? There you are. If you've ever seen Fred work, I'm exhausted when I come home. He gets me up at 6 a.m. He somehow drives me. Jennifer is there. Around midnight, we sit down, and he said, would you like some dinner? What drives him, in addition to being, quite the workaholic, his wife would say, it's a social justice mission. There's kids to save. There's research to kind of create so that he can influence what happens to kids not only in his home country but across the globe. The other thing that I think is really important, Fred, about the work is that you're dual focused. You're focused on the individual, but you're also focused on the collective and the public issues. And so I think that that's a really important part of this conference, and I think a really important part of your day. This is just a small little family meeting that Fred hosts in Uganda. I'd never seen anything like it, and I had been fielding family-based interventions for my whole rest of my life. People walk for miles for a long time to come and to talk to Fred about their intervention, about their young people. And so it was really our privilege to travel there last summer. I know many of us, Susanna, Claude, and others have been your guests. You've treated us really well. But the biggest I think, benefit to me was to see families and communities, and if Father Cato were here, you're going to meet him, I think, later today, the commitment of community to raise up the next generation for young people. So thank you so much for having me, and congratulations, Fred, on a really nice turnout for your conference. Hello, Lucy. Yeah. So if I heard Lucy correctly, she's asking me, what do I think the key ingredients are? And we're actually trying to do a lot of within-the-box studies to try to have kids give voice to what are the features that really do engage them and what are the places that they really are turned off by programs like StepUp and others. So the first is choice. Is what we are hearing over and over again, is that the opportunity to have some input in terms of how you put your involvement together, even if you choose all the components, which I think you actually should because they're pretty fantastic. So I think that notion of respectful choice, that's a kind of a concept that we've been building into our family interventions as well as our work with young people, I think incredibly important. The second thing is the language that we use around how you, why you are involved in this program, what are the needs, what are your challenges. I think that if you approach these kids and said, you need mental health treatment, we would have had a very different outcome. And so how you think about the smallest things from, kids get referred to StepUp. That doesn't sound very good. Right? You get referred, that must mean that something's kind of wrong with you. You could be nominated as well. You could be endorsed as well. And so how we use language, how we really set a strength-based, we all talk about strength-based, but then we go right into that psychopathology language that we all learned in clinical school, I think is incredibly important. The third thing is that although we think your mental health is important, we think how that shows up in your life is you're not doing well in school. And I know very few young people that don't wish that they were not bottoming out of high school. It does not feel very good to a young person to show up in class and know that they are way behind, they haven't a clue what's going on. And so if you can tie your program to what's most relevant and also be hopeful that even though you're a full academic year behind, there's some options and supports that we can use to kind of help you catch up, I think that that's really important. I didn't get a chance to present our data around hopefulness, but I think there is this notion that there might be a future. For many of our kids that feel like there are obstacles in their way that are too big for them to surmount, and the notion that with support they can surmount that, I think that that's really important. So the notion of future, hope, and then I think also resources. I'll tell one just quick story. Last week we were in Washington, D.C. for the National Council annual conference. It's about 5,000 people that come from the mental health system. And 4 StepUp youth brought their Photo Voice project to present to the whole conference. The level of both nervousness and excitement of those young people were immense. It probably did more to boost any self-esteem, motivation, feelings of competence than anything I could have done in some kind of talking therapy. They looked fantastic. We took their pictures. They met the head of the Department of Health in New York City. And so kind of our ability to package services and programs that really boost kids up. I know Neil's son is here. I met you as a young person. But the opportunity that my children and Neil's children have to come to the university, to present, to feel comfortable in these contexts, that's some of the other things that we have to give our kids. So.
Great. So we have 2 more questions. I have one here. Is there anyone else who has a question? All right, let's start with you and then we'll go to our second.
Thank you very much. I'm curious quickly about the staffing for the program, what the age of your tutors is, and I also saw that in addition to counseling, there's texting. Is that a consistent relationship with the same tutor, or is it somebody else in that particular program? Thank you.
So we're in an interesting state right now because there's, with our Medicaid, our Medicaid redesign, you can have a much more expanded kind of workforce and still support some of this with mental health dollars and some of this with research dollars. So the age of our mentors, typically those are clinical social workers. We'll call them one-on-one mentors, but in fact they're folks with a clinical background. Our tutors could be college students, our tutors could be teachers, our tutors could be volunteers. Our tutors could be actually programs that naturally exist in the schools that kids don't take advantage of, like the Writing Center tutors. So there's a whole range of, folks that we try to marshal to wrap around kids. Some of the Medicaid redesign in our state is going to allow us to pay with public dollars for some of those new supports that we were never able to do, which is very, very exciting. And so there's a real range. Once in a while, a clinical social worker really could help you with your math. It's engaging, it's relevant, and maybe not this clinical social worker, but one. And so I think that that's the other piece, is that we're trying to kind of integrate the academic tutoring into clinical sessions, into group meetings, and into kind of more formal tutoring. Liz, did you have one
Great.
more?
Yes, we have one more question. Maybe you can. Oh, I thought you said you had one. I'm sorry. Do we have one more question? Here.
Thank you very much. I think it's not a question. It's more of a comment, an observation. My name is Timothy. We met in Uganda when you came.
I thought so, but I couldn't have said your name. Thank you.
All right. I just wanted to commend the StepUp model. And, as you were presenting, I was really thinking about what's happening in most parts of Sub-Saharan Africa, taking Uganda as an example, with a high school dropout rate of about 67%.
That's right.
I actually think that this model would actually be very relevant in addressing some of the challenges around the school dropout rate there. I guess the question would be, how do we contextualize this to fit the challenges that the young people are facing in Africa? But I think it's an excellent model.
So I would look to some of the work that you and Fred and others have done already. So for example, I'm not the first one to have mentors. Mentorship is a core component of SUBI. And you know that you have those college students traveling to Rakai, really working with your young people in SUBI. And so there are some components that I think you've done some work already that you could really think about it. You might also, is Miriam here somewhere? There you are, Miriam. Miriam just wrote a paper in the Global Journal for Social Welfare. And Moo, if I got it wrong, you shout that out. That focuses on the mentorship component with Fred. And so that paper kind of talks about some of those components. The mental health, the clinical social work piece, that's not going to be as easily translatable. But I'm not sure, and that's where kind of Lucy's question and the other question around who are these people, what do they need? I think we could really think about what needs to happen in that more mental health focused piece. We do a lot of work training and testing the impact when we train community members in evidence-based programs. There was a program called study called Champions once that Susanna, this is my whole life, funded by NIMH, that really saw that community members could be very well trained in EBPs and deliver them and get very similar outcomes. And so we can think hard about what part of this model would be helpful to Uganda. Thank you, Timothy. Thank you.